Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and definitely this will make you easy in studying. However, since last few classes, last 8 parts, we have covered the newborn care as explained in Ayurveda. So today we will have the continued portion of the same. Today we will discuss what is the concept of snana or bathing in Ayurveda for the newborn baby. Now, as far as snana is concerned, all the acharyas have mentioned the importance of the snana in the newborn baby. If you go through Charak Samhita, it's very clearly told that Tataha Pratyagata Pranam Prakriti Bhutvam Abhisamiksha Snana Udaka Grahanam Abhyum Upadayet. What are the materials which is used for that? That is Shira Vriksha Kashayena Sarva Gandhodakena Vaha. And this is as told by Charaka. Whereas Shushruta says that Bala Tailena Abhyanjam Kshira Vriksha Kashayena Sarva Gandhodakena Va Rupya Hema Prataptena Va Varinam Snapayet Enam. And also mentioned Kapitta Patrak Kashayena Koshnena Yata Kalam Yata Dosham Yatha Vibhavancha. Now this is very important. Yatha Kalam Yata Dosham Yatha Vibhavancha. That is, Snana should be given to the newborn baby by considering Yatha Kalam, maybe winter season or summer season or rainy season, Yatha Dosham, the dominance of the doshas, Yatha Vibhavancha, by considering the strength of the child. It may be a preterm baby, post-term baby, low birth weight baby, etc. Similarly, Ashtanga also mentioned Kshira Vriksha Kashayena Sarva Gandhodakena Vaha Koshnena Taptarajata Tapaniya Nimajjani. Now go to Ashtanga Sangraha. Again he says Tatra Kshira Vriksha Kashayena Sarva Gandhodakena Vaha Tapta Tapaniya Rajata Nirvapanam Koshnena Kapitta Patra Kashayena Va Tadvidena Snapayet. Then Bhava Prakasha says that Abhyanga Udvartanam Snanam Netrayo Ranjanam Tataha Vasanam Mrudu Yattacha Tatha Mrudu Lepanam Janma Prabhurtir Pathyani Balasya Etani Sarvadaha. Bhava Prakasha very clearly says Abhyanga, Udvartana, Snana, then Rasanjana, Netraranjana, that is Rasanjana, etc. should be given to the baby. Okay? Vasanam Mrudu Yattacha. That means the bed sheet, that is bedding, should be very mrudu. Tata Mrudu Lepanam. The lepana should be also done, and that should be also mrudu. So Abhyanga, Udvartana, Snana, Netraranjana, then Vasana, then mrudu lepana, etc. should be given to the newborn baby. He says Janma Prabhurtir Pathyani. This can be given from the beginning itself because it is Janma Prabhurtir Pathyani Balasya Etani. So therefore it should be given to the baby. It should be administered to the baby or applied to the baby. Now, if you look into the concept of this snana, these are the references which is provided. Charaka clearly here says that Tatra Pratyagata Prana Prakriti Bhutam Abhisamiksha. So Charaka has not shown any urgency for bathing. He says that once the baby is get stabilized, Pratyagata Prana Prakriti Bhutam Abhisamiksha. Once the baby is get stabilized, once the baby attained its normal Prakriti, that means get stabilized, then only you go for such a little brisky behaviors, brisky maneuvers. Okay, so snana means is what you mean to say when you are doing snana or giving bath to the child. So you are handling the child. So usually you will say that excess your handling of the baby is not good in the initial 1 or 2 days or 1 week. You should go for minimum handling. So that's what actually Charaka is telling. Charaka is telling that once the baby totally gets stabilized, then only you go for snana, abhyanga, etc. Till then you can postpone it. Then for this again he mentions that water which is medicated with the drugs like Kshira Vriksha Kashaya. Kshira Vriksha Kashayas are basically Kashaya in Rasa and Shita Guna Pradhana. Okay, Shita Guna Pradhana and Kashaya and Rasa, and so they are quite good for the delicate skin of the baby. Kshira Vrikshakashayana, and also antiseptic in nature. Kshira Vrikshakashayana and Sarva Gandhodakenava, those drugs which are having good fragrance. We know that any drug which is having a strong aromatic smell or fragrance, etc., naturally it will act as an antiseptic and disinfectant. Okay, so drugs which are have the fragrances, Sarva Gandhodaka, all types of Sarva Gandhodakenava, or a water which is processed with a red hot iron ball or silver, gold, etc., can be also used. Similarly, one more drug which is mentioned is Kapitta Patra Kashayana. Kapitta Patra Kashaya can be also used for the same. Further, the Charaka and Shushruta both says that Snana should be given as for the dominance of the dosha. This is what I already explained. When you are giving the Snana, Shushruta very clearly says that when you are giving the Snana, you should consider three important things. Yata Khalam, Yata Dosham, Yata Vibhavancha. Okay. For all the babies, you should not follow the uniform rule. Looking at the situation, condition, and the demand. So you have to go for that. Definitely in case of the preterm babies, there is no need for urgent snana. Whereas in normal babies, definitely you can go for snana, abhyanga, etc. in the routine way. Whereas in the low birth weight and as well as preterm babies, definitely you can postpone. In the winter season, again, there is no need to give daily snana. Whereas in summer season, you have to go for snana because there is a lot of sweating and all those things, and that may lead to infection of the skin. So anyway, this depends upon the situation. Now looking at the comments with regards to snana which is mentioned in the Shastra, snana should be done after considering the dosha dominance of the neonates. Okay, that is very clearly mentioned. Yatha kalam, yatha dosham, yatha vibhavancha. Vibha means strength. Now Vatahara Kashayas can be given in the dominance of the Vata. So when he says that snana should be given by considering the doshic dominances. Suppose the child is having more Vataja properties. Suppose if the child is having more Vataja properties, for example, skin is very dry, suppose. Skin is very dry and child is lean and thin, skin is very dry. Vataja symptoms are more. Then the drugs should be selected should be of Vatahara properties. Likewise. Similarly, drugs will be selected as for the nature of the season and also doshic dominances in the season like Kala, Vasanta Rutu, Shishir Rutu, Hemant Rutu, etc. Snana should be given by considering the Vibhava. Vibhava means the strength of the child. Okay, so capacity of the child, the strength of the neonate, maybe preterm, postterm, term, low birth, IUGR, etc. Now, early bathing may remove the Werner's gaseosa, which otherwise helps in the maintaining of the temperature of the newborn in the cold season and in the cold climatic countries. Now, as far as snana is concerned, there is little controversy in the Western standard and Indian standard. If you look into the Western books, they very clearly say snana should be postponed maybe up to weeks and months together. That is owing to the condition of cold climatic condition in those areas. Especially in the Western countries, so cold climatic countries where temperature falls below 0 degree, in those areas actually maintenance of the temperature immediately after the birth itself is a big challenge. And there is no need of urgency in bathing. Suppose if you are giving abhyanga or bathing etc., that will going to remove the Werner's gaseosa, which is a natural covering to preserve the heat. So owing to that, usually they will say that the snana should be postponed. Snana should be postponed, it should not be given in urgency. So this is true for the Western countries. But whereas Indian continent is concerned, Asian continent is concerned, where is considered under the tropical areas where sweating etc. is more, and if the baby is not cleaned immediately after birth and if the baby is not cleaned daily, definitely there is chance of getting skin infection and some of the allergies. So therefore, snana should be given from the first day itself by following all the rules and regulations as far as the tropical countries are like India is concerned. Definitely the snana can be postponed for weeks to months together depending upon the situation in the Western countries where the cold climatic area is there. Similarly, in relation to this, one more important thing which is mentioned is a baby massage, abhyanga. Abhyanga udvartanam sthanam pratyayancha samacharet sahadeva stitha sahadeva stira kaunti kumudo utpala chandane. So these are the drugs which are mentioned to prepare the oil for the baby massage. Brihati phala tarkari sarshapa kushta saindavai ashwagandha bala eranda tila apamarga tandulehi atmaguptel phales taila sajak shirvipacha. These are the different drugs and drugs which are mentioned, by using which we have to prepare the oil, and by using that oil you have to give the baby massage. Now, application of the oil, massage and bath, they should be followed in a order. Actually, in Indian continent, what we follow is, first we'll go for application of the oil, then we'll go for the massage by using the same oil, and this will be followed by the bath. So this is the order which is followed in Indian or Asian continents. Now, Ashtanga Sangraha very clearly says that, suppose if you are giving abhyanga, for the abhyanga there should be an oil. The oil should be preferably prepared by Sahadeva, Stira, Kaunti, Kumuda, Utpala, Chandana, Brihati, Tarkari, Sarshapa, Kushta, Saindava, Ashwagandha, Bala, Eranda, Tila, Apamarga seeds, Atmagupta, that is Kapikachu, are made into Kashaya and added with Ajakshira. This oil, when mixed with the curds, honey and yava 3 times in quantity, is good for baby massage. Of course, oil Stilataila is taken as base, then curds, honey and yava should be added in 3 times, and Kashaya is prepared by using the above mentioned drugs, and at the end you have to do the massage by using this particular oil. This is mentioned in Ashtanga Sangraha. They says that this particular oil massage will drive away all the bad effects of the evil spirits, and also it is pushti dahayaka, and it is also having nourishing effects. Of course, we can also use so many other oils also, like Bala Taila is there, Ashwagandha Bala Taila is there, many such drugs are also mentioned. Bala Taila is mentioned in the context of Prana Pratyagamana, that is also good. Now, for the oiling some other drugs, for example, massaging the drugs like Murva Mula, then Rajani Dvaya, then Yava is also good. Powder of the Kulatta or the powder of Ashwagandha can be also used, and paste of any cereals may be also used. Water boiled with the Jivaniya Gana drugs is also good. Now, regarding the baby bath, many controversial opinions exist in the present day practice, as I explained earlier. Some suggest that early bathing should be done, while some suggest that we have to postpone it till 1 to 2 months or weeks together. As I told earlier, countries with the cold climates prefer to postpone the bathing, while in tropical countries like India, it is daily indicated. Abhyanga has got its own benefits. Abhyangam machari nityam sa jara shamavatavaha drishti prasadaha pushtyayu. So Abhyanga increases the blood circulation. Abhyanga will be enjoyed by, when you are doing the Abhyanga, baby enjoys a lot. More than that, we daily doing Abhyanga give an opportunity to the mother to identify some minor or major abnormalities which is present in her baby. When mother is doing the Abhyanga, it's the right time to identify whether there is any minor congenital abnormalities etc. is there or not. Now, Abhyanga in the newborn baby is a very popular method of baby care in India, especially traditional Indian way of this bath and oil massage over the extended legs is very, very famous, and also the safe procedure. When you're giving the bath to the child, the traditional Indian women, so they give over the along the extended legs, they keep the baby by facing face downwards, then they will do the Abhyanga first, followed by the Snana, and this is how Indians usually follow this baby massage and Snana. And nose will be directed downwards, so there is no chance of aspiration and all, and one of the safe method, and there is no entry of the water etc. into the orifice also. So over the extended legs, the Indian mother used to give the bath. It's a very famous procedure. Now, as the same in the Indian countries, India like tropical countries, usually it is daily done. But otherwise, you can also go for the tub bath also. If you are not able to do with the extended legs like in traditional Indian method, you can also go for the tub bath in the later months. Now, low birth weight babies and preterm should be given bath with great care. That's very important. Starting from the temperature maintenance, then cleaning up the orifices, chances of aspiration, reflex bradycardia. So many such problems are there which may cause problem in the low birth weight babies or preterm babies. So we should be very, very careful. This point is very clearly explained by Charaka also in the above words. The words we have seen that first Abhyanga should be done by the Taila like Bala Taila followed by the bath. Then this is almost a repetition. Already we have seen Charaka mentioned that Kshira Vriksha Kashaya should be mentioned, and Kshira Vriksha Kashayas are basically Shita in nature, Kashaya in nature, Pitagna, and it is also Vatahara. Similarly, they are anti-infective in nature, antiseptic in nature, and they're good for the delicate skin of the baby as they are very, very smooth. And it will also maintain the pH of the skin and prevent the skin infections. Talking about Kapitta Patra, that is Pitta Kapha Nashaka. Kapitta Patra is one more drug which is mentioned for Shishu Snana, that is Pitta Kapha Nashaka, while Sarva Gandhodaka is Vatagna, and also it is also very good, anti-infective and disinfective. Meantime, again, the drugs which contains the strong aromatic smell are always antiseptic in nature and imparts the soothingness, and rightly the same drugs are mentioned in Shishu Snana also. Bhava Mishra opines that oil massage and bathing are congenial to the baby from the beginning itself, as we have discussed in the first slide. Hence, it should not be denied. But talking at certain precautions. Yes, the water we are using should be preferably warm, gently warm, clean, and aseptic water should be used. Traditional method of bathing over the extended legs of the mother is very, very safe method, and baby enjoys that lot. Then don't give the bath in full stomach as sudden aspiration can take place. So preferably make sure that when giving the bath, child is not having full stomach of the milk. Rather, it is better to give in the empty stomach. Because suppose if it is in the full stomach when you are giving Abhyanga and Snana, so there may be sudden aspirations, etc., which may be fatal at times. Oil massage followed by the bath is always good. Oil massage increases the blood circulation, increases the muscle strength and tone. Moreover, the baby enjoys it, and baby also will have a sound sleep after massage. And lastly, the small congenital abnormalities can be detected by the mother during the process of Abhyanga. Water should be dried, and all the external orifices should be cleaned thoroughly after the birth. Now, suppose if the ear cavity is not cleaned properly, orifice, that may be a cause for the otitis interna or otitis media. So therefore, this cleaning of the orifices, all orifices, is very, very important. So this is all about Snana and also Abhyanga. In the next class, we will discuss one more important newborn care as explained in Ayurveda. Thank you very much.